This PowerPoint presentation highlights key aspects of community assessment. This presentation addresses the 4 student learning outcomes identified on this slide. These same learning outcomes were utilized to develop the exam questions for this unit on public health principles. I would encourage you to use these learning outcomes to help you to prepare for the content on community assessment in your exam. So what is meant by community assessment? The 2 major components of community assessment relate to the collection of relevant data and then analyzing and interpreting this data. You already have experience with assessment in your current nursing practice, but what is it that makes community assessment unique? It's really the emphasis on community or populations, not individuals, and then identifying those populations at risk. Community assessment also focuses on physical or social environment, or what we refer to often as the determinants of health. In your clinical practice, when was the last time you asked your client about where they lived or their ability to afford their medication or food, some of those physical or social environmental factors? Another unique aspect of community assessment is that it includes information on the community's strengths and resources that can be utilized to address the needs. So the definition on the previous page relates to which of the 3 types of community assessment presented on this slide. It's actually comprehensive. The definition provided by Garcia, Schaefer, and Shun relates to comprehensive assessment. So there are 3 main types of assessment: comprehensive, focused, or problem-oriented, which is what your textbook refers to focused assessment as, and then a familiarization or a windshield survey. All county health departments in Minnesota are required to complete a comprehensive assessment about every 3 years. As part of the Affordable Care Act, healthcare facilities are also required to conduct a community assessment. I think this slide does a good job of identifying the distinguishing characteristics between each of the 3 types of community assessment. You will also, in Nursing 4571, which is your public health clinical course, you will be conducting a focused assessment or problem-oriented assessment. If you've completed this course already, your focused assessment was on homelessness. If you haven't completed this course yet, your focused assessment will be on food insecurity within your own community. Familiarization or windshield surveys are often referred to as shoe leather epidemiology because you're walking around the community or observing things within your community through the car windshield. It's not as in-depth as the comprehensive or the focused assessments of the community. Your text does a good job of describing the key aspects of the windshield survey and what things you should be considering. It's also important with a windshield survey to be viewing the community at different times of the day. And why might that be? Do you think that there are differences in who is out and about in your community in the morning versus in the evening hours? How about differences that you might observe between weekdays and weekends? So it would be important to be looking at your community during different times of the day and different days of the week as well. So when should you use each type of assessment? Focused is commonly used when a windshield survey is insufficient and a comprehensive is too expensive. Planning for the health of the community emphasizes the need for teamwork. Public health nurses need to understand the context of the lives of the people in the community. And how might they do that? How they do that is actually by partnering with communities. They need to build mutual relationships based on trust. We need to be able to, as public health nurses, respect their autonomy and adapt nursing practice to meet their lived experience. There also needs to be a focus on the 3 E's. Egalitarian, which means equal relationships with family, individuals, and communities. Enhancement, how might we increase the community's strength, resiliency, and resources? And thirdly, empowerment. How do we advocate for the community members and give them the confidence to manage their own health needs? These community partnerships are key. If we think about the public health wheel of interventions, there are really 3 triangles, or there are 3 wedges within the circle that promote community partnerships. Those are collaboration, coalition building, and community organizing. I believe these wedges are actually colored orange within the public health wheel of intervention. So when we think about collaboration, we're talking about working toward mutually defined goals. Coalition building, we're talking about promoting and developing alliances within our community. And community organizing is taking it to that next step where we mobilize the resources to help us in developing and implementing interventions. The role of community partners is key and is crucial to a successful community assessment. Let's talk a little bit more about the community assessment process itself. This should look familiar to you in that it really does mirror the nursing process. Your textbook also makes a comparison between what they call the health planning and what I call the community assessment process in comparison to the nursing process. So the first thing that we need to do with our assessment is gather that subjective and objective data for our community. We need to think about what are our data sources. Things that exist within our own community in terms of data sources might be surveys, epidemiological studies, community forums, focus groups. Specifically, we can access data from WHO, the World Health Organization, the U.S. Department of Health and Human Resources Services. You should recognize that resource. They are the developers of the Healthy People 2020 document, the Center for Disease Control and Prevention. Even your local Chamber of Commerce may serve to have some data sources. So it can be local, national, and international sources that you might utilize to collect that data. You also might have what we call primary and secondary sources of data. Primary sources is data that's obtained directly from your community. So what might be some examples of primary data? Some might include your windshield surveys, focus groups, key informant interviews. You would actually be getting and collecting that data directly from your community, which makes it primary. So secondary sources of data might be population-based surveys, census data, vital statistics. Some of those things we would refer to as epidemiological data. So those are secondary data sources on our community. So how about the vital signs of the population? We talk about it, vital signs with populations, we're referring to health status data. So what are these vital signs in the community? They include things like mortality rates, life expectancy, morbidity rates or measures of illness in our community, health behavior data, things like smoking rates, exercise rates, percentage of people that wear seat belts, health and life satisfaction surveys such as quality of life surveys, and functional health data are all considered vital signs of the population. So once we gather this assessment data, we move through that process by establishing priorities and a diagnosis, moving then into a plan based on those priorities, developing the interventions, and then evaluating the effectiveness of those interventions. The next slides will talk a little bit more specifically about each of these steps of the community assessment process. So when we gather this data and identify these needs within a community, It's important to recognize that it's generally not feasible to address all the needs because of funding and resources, so there needs to be a priority setting process in place to help determine the order in which goals should be addressed. It's really not about what the public health nurse wants or is interested in pursuing. It's rather about prioritizing what the community needs are. Some of the things that we can look at in terms of helping to prioritize needs are those listed as bullets on this slide. Some other questions that you might want to consider are, what are the incidence and prevalence rates of major diseases? What are the health risk behaviors in the community? And what are the health concerns within the community? What also is the major cause of death or disability in the community? To get at some vulnerable populations, you might want to ask the question, what populations are most affected by the health problem? And then thinking about what are the major health risks in the community? Is it obesity, air pollution, lead-based paint, seasonal flooding? We think beyond the physical concerns of the individual, and we move into some of those social and environmental aspects when we're thinking about a community. What health needs are met by current resources? What health needs are not being met? Are there affordable and effective interventions available for those health needs? And who is responsible for meeting these health needs? These are all important questions to consider in helping us prioritize community needs. Once we've identified those priorities, we then begin to develop our plans and move into specifically what we would call our interventions. It's really important that those goals related to interventions are mutually defined goals, that there's a collaboration between the public health nurse, other agencies, and the community itself. Those goals need to be based on community values and beliefs. They also need to relate to the community's willingness to change. We also need to be thinking about the resources that are available and a consensus in terms of what is achievable. We have many public health nursing interventions that can be implemented to address community needs, and it's crucial that these interventions are based on the best evidence available. Our Healthy People 2020 document provides us with excellent resources on best practices and evidence-based interventions that can be implemented within a variety of communities. The last step then of the community assessment process is evaluation. There are really two types of evaluation. One is called formative and the other is summative evaluation. With formative evaluation, we want to focus on the process of implementing interventions. So the questions of what went well, what didn't go well, what might you do differently, or how might you approach things differently, those types of questions would be focusing on the process or focusing on the interventions themselves. Summative focuses on goals or outcomes of the interventions. So the first questions were mutually defined goals met. That would really be looking at summative. So once we take a look at and evaluate this information, we then need to be asking ourselves, so what is next? What might we do differently? How might we modify or change these interventions if we haven't achieved the health outcomes in our community? And then another important piece is the maintenance of effort. In other words, what needs to be in place to continue this intervention? Is it resources? Is it further training? Training the trainer perhaps? What kinds of resources and what kinds of things need to be put in place to continue these interventions within our own community? And then that brings us back to that assessment process again, this ongoing piece of taking a look at where we're at, whether or not we've achieved those outcomes, and continue to gather data and develop interventions to improve the health of our community. So much of what we've talked about has focused on the outcomes of community assessment to be used in developing programs and services to meet unmet needs in our community, but it's also important to recognize that the assessment data is also used in several other ways. It can also be used to obtain data to inform program planning, and it can be used to obtain data for use in funding applications. Besides identifying needs and strengths and assets of the community, other benefits of the community assessment include community agencies used to assess their services. They can identify whether or not the services they have in place are effectively addressing the needs within the community and how they might better address the needs in the community if they are not being met. It also promotes community engagement in the assessment process. Community assessment helps to establish an inventory of community resources. What do we currently have in place to help to address these issues? And it increases the awareness from the community members about the overall health and well-being of their own community. Here's the list of resources that were used in the development of these slides. I would also encourage you to read the assigned readings on community assessment as identified in Unit 1, Public Health Principles.